If you ask somebody who has done EMDR, a lot of times they'll tell you it was strange, but that it worked. What is EMDR? EMDR stands for Eye Movement Desensitization Reprocessing. If you look at the definition, you'll find that EMDR is an 8-phase psychotherapy with standardized procedures and protocols that contribute to therapeutic effect. But I want to take this time to go beyond definitions and explain to you some of the specifics about what EMDR is. You're probably watching this video right now because you heard something about EMDR and you want to find out for yourself whether or not it can work for you. I would tell you this: it can work for anyone if two things are in place. First, a good therapeutic relationship has to be in place. And second, it depends on if the therapist knows how to get past the resistance in the client's mind that might come up during the process. If you look at the research studies on EMDR, from those studies you'll find that it can be very effective. Just look at the following research studies. EMDR therapy was superior to a variety of CBT techniques. Almost all the patients did not have PTSD after the EMDR treatment. 12 sessions of EMDR eliminated post-traumatic stress disorder in 77.7% of the multiply traumatized combat veterans studied. There was 100% retention in the EMDR condition. Effects were maintained at follow-up. All participants met the criteria for PTSD on assessment and demonstrated a significant reduction of PTSD and depression symptoms at post-treatment as well as at a 5-week follow-up. At follow-up, 49% were no longer diagnosed with PTSD. Both EMDR and CBT produced significant reduction in PTSD and behavior problems. EMDR was significantly more efficient, using approximately half the number of sessions to achieve results. For more, go to www.emdr.com under Research Overview. And in many other research sites, you'll find example after example of conclusive evidence that EMDR is very effective in helping people achieve their goals in counseling. But again, it only works well if you have a good relationship with your therapist and that therapist knows how to get past the resistance in your mind that will come up during the process. When I talk about resistance, I'm talking about the part of you that doesn't want to go there. Ever notice how part of you might want to do something and part of you doesn't want to do it? That's what I mean when I say resistance. Personally, I use a method called IFS to help my clients move past their resistance to the process, and then they are able to get the most out of their EMDR sessions. So how does EMDR work? Well, to understand that, it's helpful to understand why we have problems to begin with. Ever say to yourself, I wish I wasn't so hard on myself? I wish I wouldn't react to people's criticism the way that I do. And why is it so hard for me to be happy? A leading trauma expert, Dr. Bessel van der Kolk, says that trauma is a physiological reaction that needs to complete. In other words, it's a physical process that needs to finish the right way instead of the wrong way it did way back when it happened. When something really negative happens to us, sometimes that trauma gets stuck in the lower regions of our brain. For those of you that like science, when the amygdala kicks into gear because of a dangerous experience going on, it activates the fight or flight response. Cortisol and adrenaline then shoot up from the adrenal glands into the brain and constrict the hippocampus and keep it from integrating the bad experience into proper memory storage. So it's like the traumatic experience we went through gets stuck in the basement of our mind, and EMDR is the tool that helps get it out of the basement and integrate that experience into our present-day reality. EMDR therapists do that with 8 phases that eventually include using a light bar, headphones, paddles, and sometimes tapping. It is the back and forth nature of EMDR between the right and left hemisphere of the brain that helps the trauma move through the hippocampus and create proper memory integration. When this happens, we no longer have to react poorly to that past event, but can make our decisions from what I call the smart part of our brain, the prefrontal cortex. You might wonder, is it that simple? The answer is, well, there's a little more involved. There are other things involved that a trained EMDR therapist does, such as a float back. Here's how a float back works. Consider this example. Maybe someone is experiencing extreme stress and reacted poorly after they were criticized by their boss about something. That's not usually a pleasant experience for anyone, but for this client, it caused a major problem emotionally. They just can't let it go, and they're terrified about the next time it happens. The therapist would then help the client do a float back. The therapist would ask the client to go inside and feel what it was like to experience that with their boss, and then think of an earlier time when they felt that way. This is called using an access point through emotion. Experiences are linked together in our memory by a similar feeling or emotion. Once the client identified an earlier time, the therapist would again ask the client to think of an earlier time that they felt that way. And they would do this again and again until they got to the earliest memory the client can recall, what therapists call the target memory, which is where we begin the EMDR processing. Once we get the target memory in EMDR, we ask the client what the worst part about that memory is. We would ask them what negative belief about themselves it created, and we would ask them to notice if they feel that anywhere in their body. You see, our bodies remember bad experiences through our nervous system, and all of this gets processed out when we do EMDR. It's a form of therapy that doesn't just help you cope with your issues, it goes to the root of the problem and heals it so that it never comes back to bother you again. It gets rid of things like anxiety, depression, anger, compulsive behaviors, poor self-esteem, and so many more issues that people deal with. Some people always think it's too good to be true, but for that I would invite you to look at the research and feel free to call me for a 20-minute free consultation at 616-460-4824 if you live in the Grand Rapids area. I would love to sit down with you and explain further how EMDR can work for you. Thanks for watching.